Hey, and on this week in pharmacy, we're returning to a safe spot for me. Because if you talk about, uh, I remember the name of the condition, hyperlipidemia. I mean, if you start talking to me about clinical stuff, unless I have a really good outline and a pharmacist at my side, that's where you start getting into the weeds of pharmacology, and I get scared. It's a scary place if you're not a pharmacist, and I am not. I am your biggest fan, leader of our podcast world, and how important the word and the ideals and the efforts of our pharmacists are. It is American Pharmacist Month. I want once again to wish everyone a happy American Pharmacist Month. We appreciate everything that you do. We're talking technology today. We're thinking, how do pharmacists help lead wellness and public health and safety in the crucial role that I know that they play in all sectors of long-term care and rare disease state and community? But let's start talking about the leveraging of technology to help us do that. And I'm excited about two guests that I have from AssureCare. I would like to welcome Parth Shah and Dr. Tara Pfund to This Week in Pharmacy. Welcome.
Hi, thanks for having us.
All right. This is your first show. I know this is not a first rodeo for Tara. You've been on a lot of podcasts, including some throughout the Pharmacy Podcast Network. We very much appreciate you. Parth, tell us about your podcasting background.
I did one with Beth on pharmacy with Tara, I think a couple of months ago. That's my background. It's a one, and I was supposed to be done, but I'm not.
Well, this will not be your last. Once we start weaving into other people throughout our network, we always have people back that can tell us more about what you're doing. I'm going to start with Tara because it is American Pharmacist Month, so you get to go first. And that is, just tell our listeners, tell the Pharmacy Podcast Network listeners and This Week in Pharmacy a little bit about your background and your involvement with AssureCare.
Yeah, absolutely. I'm out on the West Coast. I actually live in Washington State. I did a lot of years around advanced pharmacy practice models. Washington's and Oregon and California are pretty famous for pharmacist prescriptive authority and various payment models tied to both scope and reimbursement. So that's been a lot of my career. I did a community-based residency and spent a lot of years with Kroger Health doing national community pharmacy programs. And along the way, I saw how badly we need technology to really support pharmacists to be successful in these more innovative payment models. And so that was actually how I wound up at AssureCare. I've been really lucky to be able to work on different avenues supporting pharmacists implementing clinical services and clinical programs, credentialing with medical plans, using an EHR, ONC certified EHR for medical billing, and then also revenue cycle management, so getting reimbursed for those claims. And that's just one of the many software solutions AssureCare has.
Well, Tara, if I would have said to you, where'd you go to pharmacy school?
Oregon State.
All right. So imagine you and I, you'd been like this crazy guy with a baseball cap on, comes up to you, you're a P4, maybe you're getting ready for the NAPLEX. And I'm like, hey, Tara, you're going to go into technology and you're not going to be dispensing or anything. Like, what would you have said?
I would have said, no way. I definitely was convinced I was going to do direct patient care. That was why I did the community-based residency. It was the first one out on the West Coast, actually. There hadn't been one. And I was like, we should have pharmacists doing ambulatory care in our community pharmacies, managing chronic disease and population health. And that was what I did the residency to do. And basically during that residency, found myself more creating those roles for more pharmacists to be able to help have it in more pharmacies across, at the time, Fred Meyer, which was in 4 states, which quickly grew across the country for Kroger and now the nation with software. So it's a surprising turn of events, but I love it.
It is. All right. We have to hear from you, Parth. Give other listeners just a little background on Parth Shah.
I'm on the other coast from Tara. I'm from Boston. I live in Boston. I'm a pharmacist trained in India, not in America. And then I went and did my master's in biochemistry and protein biology from a university up in London. By no means remember what I did in pharmacy, but got back to it when I joined AssureCare. Started building products for AssureCare. I'm the vice president of a product at AssureCare, overlooking the pharmacy and the payer side of the house. So I think we've built applications at AssureCare to basically have connected care, where we are bringing all aspects of care into into the fold, and a very important piece of that was pharmacy. Our CEO, I still remember, always uses this example when was told a traditional care management company is going to enter the world of pharmacy and pharmacy management. Every investor on the block said, hey, you guys should not be doing that. You guys need to stick to your lane, because pharmacy was not vertically integrated into care management at that point. Now, when what Tara and experts like Tara have brought to the plate at AssureCare is, hey, there is vertical integration. There is a need for not only dispensing medications, but for clinical care, for integration with care management, with nutrition management. So all of that is what we as AssureCare are trying to push into the industry, that you don't really need 6 different systems when one system can effectively do 6 different things. So that's what I help build.
Thank you for that setting. I have a hyperactive mind. I can't help it. Maybe I have ADHD. Maybe, I'm not sure. But I keep coming back to some of the basics of what pharmacists have always done. And even though we're running into the ether of all things artificial intelligence, predictive modeling, technology as a form of a prescription, digital prescriptions, medication dispensing, medication counseling, and medication safety are literally the core of any pharmacist anywhere in any setting. I don't care if you're tech, if you're working for pharma in clinical trials, dispensing, counseling, safety. That's kind of like the core underlying common denominator of every pharmacist in the land, or across the globe for that matter. So let's break those down. I'm going to start with Tara. Talk to us a little bit about the AssureCare effort and platform in the realm of dispensing, counseling, and screening, which to me is another word for safety.
Yeah. And again, so we've got multiple different solutions that, kind of come together to be able to support pharmacist providers. I work really on the medical billing aspect. And so medication synchronization is essentially taking patients' medications and filling them once a month. And we've really been able to work with community pharmacy to take that kind of standard program in community pharmacy and turn that into quality encounters, so that as patients are picking up their medications, the pharmacists are not only making sure they have the right meds, but then they're also making sure that if any need to be deprescribed, if any need to be simplified, it can be once a day instead of twice a day. Maybe they're missing an important medication for their diabetes. So we really try to look at that patient holistically once a month and elevate their overall outcomes. And also, because most of our pharmacist partners are set up to medically bill, they oftentimes can bill for those encounters too. So that's a big piece of kind of taking your everyday selling of a medication, where you come in one day for one medication, the next week for another, and really consolidating that more into a version of an appointment-based model. So that's really my favorite way of kind of looking at the new way that I see dispensing pharmacy heading. And it's a lot safer and has a lot more quality outcomes.
Parth, I just got back from the NASP, the National Association of Specialty Pharmacies meeting, and we covered the event as press and media partner. I love that organization. There's so much passion there. Specialty pharmacy is just a surge of activity right now. Talk to us a little bit about the specialty pharmacy tie-in with AssureCare as well.
So we looked at pharmacy holistically. When we started with, hey, we want to do clinical care. We want to help patients not only with their drugs, but also everything around it. Hey, should the pharmacist give them more details? Do they need more educational material? Can I use technology to drive better outcomes because I know more about the patient with the data I have? So when we did that, we were missing a big component of specialty pharmacy as well. Hey, can the medications reach the patient faster on this when it comes to specialty drugs? Do they have to wait for 6 days for the drug to be adjudicated, dispensed, eligibility checks, and then they're receiving their medication? Do they really have to wait 30 days for that, 6 days, whatever that may be? So what our platform is helping is, hey, can we get this medication to the patient faster by using the operational processes or by effectively managing the operations behind the scenes when it comes to back office management? So that's where a specialty pharmacy management tool came into play. And we didn't only build the tool itself, we built the clinical criteria that go along with it. How do I do an assessment? Do I have to really go out and have a small specialty pharmacy go build their own clinical content. It's not a sustainable model. So as a technology partner, we're building that clinical content in-house and saying, hey, subscribe to our library. You don't really need to spend time to do that. So that's where technology becomes more scalable. And that's how we've approached our entire pharmacy landscape on how can we make it more scalable for the people that are using individual systems and are taking 6 months to implement a system.
Tara, I see the crossover in the bridges that AssureCare is building, and I think of iPatient care, where it's the physician, the specialty care teams, administration, and pharmacies that are playing into the data that is part of that. Talk to us a little bit more about AssureCare in the specialty space.
In the specialty pharmacy space, or the specialist providers?
Especially when the data is coming back to the EHR and what you're tracking and how you're tracking.
So we're able to receive a lot of different information on patients that are being targeted for different quality measures is a big one. So we're able to identify patients that have some type of a need to quit tobacco use, or maybe need outreach for a vaccine for children, or lowering their A1C. So that's definitely a way that they kind of play into the larger healthcare ecosystem, very similar to the physician's office right down the road. So that's a really innovative way that they're able to have that interoperability component of information, and then feed that your tobacco status, yes, no, back to those providers. So that's been a really unique way that they've been able to collaborate with the other healthcare professionals and specialists in the community using the iPatient care solutions.
When I think of back to school, my two daughters just went back in late August, September. I immediately start thinking immunization time and fall and getting ready for, I guess, what we call flu season and the next variation of COVID, or whenever that's going to please go away. So talk to us about immunization services as well. It's a huge part of the future of pharmacy, and it's going to continue to expand as we saw the prevalence and importance of it during the pandemic.
Yeah, I mean, vaccines have been around for years. It's funny, I used to teach a certificate class on vaccines and administration. First of all, now you don't really have to teach it because everybody graduates from pharmacy school with that certificate. And so that class kind of has become outdated and grandfathered for the most part. But one of the slides was about how talking to physicians, how you're not catching the patient, you're not taking their patients, you're catching the patients that would have fallen from between the cracks. And it's been really neat to watch it, where now we are the destination in healthcare for vaccines. And now we're really taking it even, levels higher, where we're able to say, not only are you the center of vaccines for healthcare in America, but also you're going to make sure I'm up to date. And you're going to kind of be that connecting piece, even for children, between the health plans, the physician's offices, the pediatrician's offices, and the pharmacy, to ensure you're up to date on all the vaccines that you need. So that's one of the ways we've really taken, kind of yesterday's flu shots into, especially, the patients in their 30s, 40s, 50s, who may or may not be all caught up on their vaccines, and really looking at, based on your conditions, your age, where you work, are you up to date on all your vaccines, and what else can I administer or coordinate you receiving? We have really neat tools at AssureRx that we've been releasing kind of more in like a clinical coordinator support role that help pharmacists be able to quickly and efficiently do those robust encounters, where not just you want a flu shot, here's your flu shot, but let's do vaccine season differently this year. Let's make sure that you are up to date on everything. Let's make sure that the pharmacies have needle stick policies in place and a streamlined way to order and supplies, and really be able to help those independent pharmacies grow those vaccine clinics this year. So we're excited to see that take off.
Parth, I got all my shots right here. Would you like thoughts with that? So
I don't think I'm going to do better than Tara, but I'll do the technology piece. From a vaccine perspective, I think we've realized the impact post-COVID. So every workflow was complex. It was hard. At point of dispensing, you're going through 16 steps to basically clinically document what you're administering. With AssureCare, what we have done is we've made it a 3-step process. So one of our largest customers, are extremely large retail/community, Tara will correct my lingo on what that is, has basically, we boosted their productivity by making things simple with technology. Technology was never about complication. It was about simplicity. I think that got lost in translation when healthcare got introduced. Hey, everything is supposed to be super complex. No, it has to be simple. So then for flu vaccines, I have algorithms that basically run on your entire patient rosters to say, you as a pharmacist need to do clinical care. Don't worry about how things are getting identified. We'll bring it to you so you can help the patient with what is actually needed, instead of you trying to figure out, reading through 20 pages of document and trying to figure out, do they really need a flu vaccine? Are they missing a gap? We have direct integration with state registries, where we're saying we're going to identify for a given member in a given state what their gaps for vaccines are. So all of that within the same technology, with what Tara was talking about with the AssureRx, care coordination, and helping these independent pharmacies, puts us in a very unique position as a landscape. And we're not only doing that with pharmacy, we include the care management component along with it. It's not only one aspect of care. So I think all of that together is going to facilitate better coordination, better, effective, and enhanced coordination, because all three are important for good care.
So I'm starting to make the longer I'm in this, this just makes sense the older I'm feeling. And I remember in 2004, when I entered pharmacy, the pharmacy industry in long-term care pharmacy, I couldn't find one pharmacist that was assigned to technology within the systems that we were selling or even competing with. And I had competed with some very well-known pharmacy management systems out there. No pharmacists were part of those teams. And now when you go to the trade shows and you go into a booth of many of these systems and providers of technology, there's pharmacists everywhere. And that makes me feel proud, because it makes me feel that our profession, which took some time to get it, really understood that if we have the people that have the most access to our patients involved in our technology platforms, it's going to make more sense for outcomes and usage and data gathering and reporting and white paper development, because it's being seen from a pharmacist perspective, and you both bring that perspective. And I think that is so important. I do want to mention and ask one more thing, because it's a part of healthcare that has meant something to me, as I spent 4 years in medication-assisted treatment centers that concentrated on opioid use disorder, and that is opioid stewardship. So I very much want, Tara, if you could give our listeners some background in AssureCare's involvement in that.
Yeah, so the identification of patients who might need naloxone, which is the opioid reversal drug, as commonly kind of said amongst the general public, and is coming over the counter eventually, or is technically available, but will be more available soon, is something that pharmacists can prescribe or dispense per protocol in essentially all states. And that's an important kind of baseline foundational piece that's been going on for many, many years for pharmacy. But again, we're kind of taking that dispensing encounter where a pharmacist are maybe selling that medication and, yes, giving naloxone if somebody asks about it, and really marrying those two clinical events that are happening in a pharmacy and helping identify those patients in the everyday dispensing workflow to ensure that they're having those conversations with the patient and or their loved ones about that important medication. Is it still in date? Do you know how to use it? Do you know the signs and symptoms of overdose? And we found that the local physicians and the patients and providers are very grateful for that additional kind of elevated service for our patients.
I appreciate you both. I have to have you back sooner, Tara, than I think it's been a while. We have to have you back. And Parth, you have to promise that you'll be coming back as well.
Yes, that would be great.
If you invite me, I'll be here.
And then the conference circuit. I know I'm headed to the NCPA this week in pharmacy. We'll be crossing over right before the beginning of that show. And then let me think of what's next. The ASCP, the American Society of Consultant Pharmacists. So what conference are you going to next, Tara?
I will be at NCPA. We have a booth. So we will definitely cross paths there. That's a great meeting and a lot of great innovative minds coming together. We'll be talking about the kind of supporting independent pharmacies and kind of a clinical coordinator type role there as one of our components of the AssureRx offering. So swing by our booth.
I will. We'll have to get a quote.
Yes, that'd be awesome.
Thank you both for being on This Week in Pharmacy and bringing the importance of pharmacists being at the center of technology and how that drives patient outcomes and how that really means a better bowl of healthcare than what was there and what was available 10, 20 years ago. And I know I'm old.
Yeah, absolutely. Thank you for having us.
Thank you.
See you soon.
Bye.
All right. On This Week in Pharmacy, next up, we'll be right back.